It is inconceivable to many other countries that the United States would have nearly 50 million people who are uninsured, and it appears that the number will only continue to grow larger. At the same time, many millions of Americans are barely holding on to their insurance. Many other millions have health insurance coverage that is structured in such a way that the marked increases in co-payments and deductibles have become an absolute barrier to accessing health care, except in emergencies. We have only to review the activities that led up to the approval and following the approval of the Patient Affordable Care Act. An even more appalling finding when reviewing mission, vision, and value statements of many healthcare service organizations in the United States is the absence of any obvious reference to human dignity and human freedom as the foundational and guiding principle for the work of these organizations. For many decades, there has been a growing and at times insidious moral shift from a focus on the person who is sick to a focus on diseases. Within this moral shift, healthcare services commodifies the human person through statistical formulas, disease aggregates, financial incentives for reducing use of health services, and a rapidly growing technological imperative rewarded by sentinel advances in expensive healthcare technology which fail to serve the most needy persons in the United States, those experiencing health disparities and health inequities. As you may well know, the present health system is currently driven by an economic ethic rather than a moral ethic. This system selectively influences and governs choices of who will receive care and treatment, and has more to do with establishing profitable cost-benefit ratios than protecting the freedom of moral choices that promote and protect vulnerable human life regarding care and treatment of both the person who is sick and the clinicians who provide the care. As a result, the dignity of the human person of both the patient seeking healing and hope and the clinician who has promised to help and to heal is compromised, leaving both dehumanized. The question, who do you really care about, can be acknowledged and answered. No individual, broken families, no social class, no ethnic communities must ever be left behind. Not the woman who is homeless and unwanted, not the black student who is dying from AIDS, not the young single mother who must decide whether to carry her unborn child to full term or have an abortion, not the children of the street, not the immigrant, not exploited persons or victims of human trafficking, not even the healthcare administrator who failed to be responsive to the poor, not the prisoner who is difficult to love, not the retired husband with Alzheimer's dementia who seeks relief from a mind entombed.